As the COVID-19 pandemic wears on, some doctors are beginning to refuse treatment of unvaccinated patients in person. For more, we're joined on the KCBS Ring Central Newsline by Paul Seegert, managing partner with PCS Advisers. That's a healthcare benefits consulting firm. Good morning.
Good morning. How are you today?
Fine, thanks. Thanks for joining us. So is this something we could start to see more often?
Yeah, it is a growing trend. We won't see it for emergency care. That wouldn't be ethical. But we are seeing a growing number of physicians who are primary care doctors mostly, who are saying they will now decline to treat those folks in person, or they're even finding them alternate providers.
Right. I was reading about one particular doctor, I believe in Florida, who said, listen, I'll see you via Zoom. I will help find you a different doctor, but and I'm going to give you a month to get a vaccine, but otherwise you got to go see someone else, and says it does not go against the Hippocratic Oath. I've also seen other doctors who say, hey, I see people who smoke and drink too much, so they're doing bad things for their health. And so I'll see these people, but it's a little different because people who are unvaccinated could be getting other people ill. So what are all the different arguments here?
Yeah, I think you've outlined it well. There's those in the profession that are seeing this as kind of an arbitrary line because 86% of the cost in our healthcare system is the result of decision-making, lifestyle decisions. Mostly it's chronic illness that causes the cost of the system. On the other hand, in June and July alone, we spent $2.3 billion in hospitalization costs for almost entirely unvaccinated people. So you do see some logical arguments on both sides of the issue.
It is really difficult because what happens if someone who is fully vaccinated has a heart attack, shows up to one of those healthcare systems or hospitals that's overloaded with no ICU beds, and they have people unvaccinated in there with COVID? You know, it brings up a lot of big questions.
It does, and there are such cases, unfortunately, where folks have either worsened, their condition has worsened, or they've even passed away because they were not able to get the care they needed, especially true in more rural areas, and those often are places where the vaccination rate is lower.
So if the vaccination rate doesn't get up to a point where this pandemic starts to, level off or come down, do you see more doctors doing this, or more entire healthcare systems starting to say, listen, we're not treating you unless you're vaccinated against COVID-19?
I think we will see it for daily care, non-emergent care. Another factor is natural immunity. Some healthcare systems, there's one in Ohio in particular, are actually accepting either vaccination, proof of vaccination, or proof of antibodies that you've taken a test and you can show that you have immunity, and which is, of course, one of the arguments that some people make for choosing not to get vaccinated. So there may be a growing trend around that as well.
All right. And just before I let you go, do you think any of these doctors who refuse to treat unvaccinated people are going to get in trouble or lose their job?
I don't think so. I think we'll see. It could be that, some lawsuits will come around or come about as a result of this, but they seem to be within their legal rights.
All right. Well, thank you so much for joining us today. Paul Seegert, managing partner with PCS Advisers, a healthcare benefits consulting firm.